A very warm welcome to IDFC First Bank presents Leaders of Tomorrow Season 13. I'm Ritwika Gupta. Tonight we turn the spotlight on India's healthcare sector, exploring innovation, global ambition and the path to building a resilient, inclusive healthcare ecosystem. I'll be in conversation with Shobana Kamineni, Executive Chairperson of Apollo HealthCo, who speaks to me about leveraging AI in healthcare to balancing global ambition with grassroots access and her vision for India's healthcare future. Listen in. Thank you, Ms. Shobana, for joining us today on ET Now Leaders of Tomorrow.
Ritvika, thank you for having me.
Now, India has made significant strides in healthcare over the years. In your view, what are the top 3 opportunities that can truly transform the sector in the next decade?
I'm glad that we're recognized as a global powerhouse for healthcare, both in the pharmaceutical space, which India does dominate. 40% of all generics used in the world are from India. And I think that's a huge power. But apart from that, it's just the very fact that within India, we serve 1.5 billion people quite efficiently across many, many terrains, that the cost of healthcare, the access, and I think that lastly, the important thing is that are we keeping people healthier? So from these 3 angles, let me say that that's the opportunity. That we do have to understand we're a large nation with very, very different price points, different geographic, locations. So how do you span that, and how do you try to make healthcare more equitable? So in this, I think that technology is the biggest leveler, and it's not, now it's AI that we can do things personalized at scale. But even before that, the very fact that we had this huge technology available to us, just even your cell phone, that can become a powerful health tool, or the way that we're doing things, the radiology interventions, or even the surgical interventions of robots. All these are just playing a great role. So technology and AI shaping it, to me, is one of the huge opportunities that is happening. The second thing is, are we making healthcare more equitable and affordable? Top of the list is health insurance, whether it's what the government has done, the Prime Minister's personal emphasis on creating the biggest public insurance for the whole country. That plus this being the fastest growing health insurance market in the world. And it's been that not now, it's actually been that for the last 10 years. And I think for the next 20 years, foreseeable future, India has a huge opportunity to make sure that more and more people are covered by health insurance, so you create more equitable access to healthcare. The third one is, how do we ready our people
Sure.
to be able to create more infrastructure for this? And I think that from 2 points. One is the actual physical infrastructure, which very difficult to build that many hospitals in the country, whether it's private or public. And this is where technology has helped. This is where companies like what we built, Apollo HealthCo 247, that creates digital access, that opens the windows to telemedicine, that allows this. The second point is, how are we training people? And I think here's the big one, that India requires to create good jobs. So to me, the future of Indian healthcare and the opportunities of healthcare are tied in through technology and AI, financial access, and to training people and creating infrastructure.
So, how do you see India's position in the global healthcare landscape today? Are we punching above our weight, or is there untapped potential waiting to be unlocked?
In terms of generics, we do punch above our weight, and this, but this is, it's very fragile. So in the world today, which is, it's so difficult to understand what will happen from almost week to week now. What happens if tariffs come in the US that make it that close the window for this opportunity? There's so much there out there in terms of the way that we, but in healthcare, fortunately, people have understood that India has a very, very strong manufacturing capability, the ability to send this. Uh, but I also would like to emphasize that, for the global south, India represents a really important space in um, giving people access to affordable care. India presents a huge opportunity for us to localize that, or the medical equipment or the consumables that we import, that while we do a great job on pharma, that India has the best in when it comes to pharmaceutical. There's a long way that we can actually, move towards self-reliance in consumables, in medical technology, and again flip this around, not just for domestic demand, but use it as a very strong export base.
Now, the theme for our show this season is Agility, Ambition, Ascent. With increasing global protectionism and geopolitical tensions, how do you see these impacting India's healthcare ambitions and partnerships? And how should businesses brace for uncertainty?
uh, in uncertainty, if you really look at it, if agility would be, how can I serve more Indians, because there are people, continuously falling sick. Look at COVID, for example. I think that that's a perfect example for India to show our agility. We had, uh, at Apollo itself, we did 23 different protocols, were from not understanding anything of how the nature of that beast. By the end of the second wave, we were able to do faster diagnosis, and by the way, our app was used by almost 11 million people at that point for diagnosis. You spoke about ambition, and would India see the necessity to be able to scale? I think that this is important for us. If you look at the pharma manufacturers I talked to, yes, they're very happy supplying, being the supplier of most of the medicines of
Sure.
the world, of paracetamol and all these things that come off patent. India will jump in and make sure they serve the world. But there are a lot of Indian companies that are saying that, why can't we be innovators? Why can't we be like the Chinese, a setup of 5 people, just creating that innovation? So I think we have the ambition, we have the talent. With regard to Ascent, I think a lot of it is about um, what kind of infrastructure.
Sure.
So to me, infrastructure doesn't need to be physical, but there's a whole space of Ascent, which is in the prevention space. Because I do believe as India ages, we have to understand the disease burden. Can you imagine today? We spend what, 1.5 to 2% of our GDP on healthcare. But suppose the real cost is translated, and you pick up more people with NCDs like diabetes, cancer, cardiac. Once you start looking at that and the burden of that, if we don't have use this as the ascent of India to say that I will reduce that, that I'll make sure that that my people, that we catch it earlier, that we treat them earlier, that we actually move towards prevention. And that prevention of ascent is in somewhat coming back to our old roots, because it won't be, it'll be a combination of using yoga, of using Ayurveda, of using our ancient sciences, but also of blending it with, making sure that people test earlier, that they have access, that you use an omni strategy for medicine. So to me, that's what I would define as scent.
It's time for a quick break here. We'll be back shortly. Stay tuned. Welcome back to IDFC First Bank Presents Leaders of Tomorrow Season 13. Tonight we are focusing on the future of India's healthcare sector, innovation, access and India's global ambitions. In a conversation with Shobana Kamineni, Executive Chairperson of Apollo HealthCo. Well, you beautifully summed up our theme, but just speaking of digital transformation, and I know you touched upon it earlier, what's that one thing the healthcare sector is getting right and one thing we still need to fix urgently as far as digital transformation is concerned?
This healthcare space is a place where technology it's rooted in that. Technology, because of AI now, as the models are continuing to evolve, we're able to take that and personalize it. For us, the agentic AI that is coming in, just look at what we have, Ask Apollo. So you have these models, the LLMs that everybody talks about, that Google has them, everyone, Chat GPT, and you can ask it anything in health. So now the search has become so much more intelligent. But what is that search? The search is not personalized. So what we've done at Apollo is that we've used our almost 20 years of medical records, layered it on that, used our doctors to actually look through specific diseases. So when it happens and your health record is embedded with us and you ask a question, we are not we are not answering just as an anonymous person, but what we're
Sure.
answering is, you're answering for Shobana, who's 60 years old, who has this kind of history. And I think that's when you really see the use cases and the brilliance of technology that is coming to play now in healthcare.
Right, and picking up from what you said, with the advent of technology, especially artificial intelligence reshaping healthcare, what must India do to ready its workforce for the fourth industrial revolution?
I think that as much as people are praising AI, they're also a bit nervous, will it replace me? And I think that whenever we think that you think you can replace a doctor, it's just so foolish, because at the end of the day, you need a person needs actual physical intervention, whether it's for a surgery or just even as for a checkup. You need to physically be there to be able to run the diagnostic test and all. That is quite down the path. But what's important is that if we think that people who are currently abled will be future enabled, big fallacy. We need to have everybody in this workforce to be trained to say what will our customers expect from us, and how with technology, how it's going to make it better for us, and how can we be more productive. What we've been able to do is actually digitize all that, AI enable it. So from the doctors, when they're looking through, they have the entire case history. It's all there. It's all summarized.
Absolutely.
And then that last, most critical element is where the doctors come into play, how they would interpret it. And I think what this does is that it gives the patient a much better experience. So this is, to me, this is a super use case.
Ms. Shobana, you pioneered India's biobank, a concept that was ahead of its time. Where does India stand today in the life sciences innovation race?
Most innovations today are based on a Caucasian DNA, and I think that while our Asian DNA actually represents a much larger portion of the population today, So I don't think that any study in terms of whether it's for whether it's for drugs or whether it's for therapies is relevant unless it has enough of a cohort of study being done on Asian DNAs. So this is what I think that India can and will play a great role. In India, unfortunately, we still have cases where we pick up cancers much later than the Western world. The ability to be able to study those has really impacted how the therapies that we invent for future. So I think India has really has a strong use case for us to be relevant to the world, and I think that while we might not have the most resources, India has enough ambition.
Now, you've also built three of the largest verticals in Apollo. Could you walk us through their unique roles and how they work together to strengthen Apollo's vision?
I've not built it. Uh, I think that we're very collective. At it it the I'm fortunate to work in verticals that really that have a large customer base and out there in the world. But I do think that in Apollo we have a very collective mindset. We started pharmacy saying that we need to have trusted medicines
Sure.
for people because of the problem of spurious drugs 38 years ago. Some of it exists in parts of India, so we continue to keep that, as top of the thing. But we also have availability because many times people run out. They don't have the kind of drug that they want, and we want to make sure that we have the best availability. And of course, the other, what we do, the hallmark of retail, more information, good practices, everything that we've done has allowed us to come to scale. And in fact, our scale is quite interesting because we probably, on an average, open 1.5 stores a day. And this is the kind of scale that we've realized. So this is a nice thing. Last year
Sure.
we did 330 million bills. The world is omni, and it's not just Amazon and Walmart that taught us that, but I think that the customer taught us that. So today, whether uh, we have our neighborhood that they'll call this thing and say, look, my prescription is with you, please can you send my medicine? And just like the neighborhood retailer will do that, but we're probably many notches above because we have a WhatsApp solution, we have an app solution, we have a web solution. And in doing that and in keeping people's health records, what we've realized, and this is the most interesting thing to me, is because sometimes people they may forget to take their medicines. We did many pilots with pharma companies and doctors and said, how can we keep people compliant? Because sometimes they just forget and they fall off and they say, okay, now my blood sugar is in range. Medicine ko, I'm going to stop it. But that doesn't work. So these are the kinds of things that we're able to help them, educate them. That we moved from being, slightly transactional, necessary, but slightly transactional, to truly working with, being there for our customers. We need to work on prevention. We need to work on keeping people well, rather than this thing of sick care. If you look at it, our supply chain companies 25 years, pharmacies 38
Right.
years. So we invested way before the curve, and I think that allowed us to get people's trust. And I, for one, am super grateful that I'm sitting here and I have the opportunity to lead those teams.
And what role do you see for MSMEs in building a resilient healthcare ecosystem in India?
To me, an MSME is also a small 100-bed hospital or a 50-bed hospital. They are somewhat, your medium scale, these things of entrepreneurs that come in and they're manufacturing good health. They might want to kind of, they might want to start finding ways that they can, match up to the best technologies of the big hospitals, which could be competitive for them. So many of our consumable companies are really MSMEs at this point. Another really important place where MSMEs will play is when we can get these big companies, and I keep talking to people, the large companies of the world that work in India, whether it's Philips, Siemens, GE, all these, they also need an ecosystem, just like the auto industry. They need an ecosystem of MSMEs. And I think here is an opportunity that as the government encourages, through PLIs and many other schemes, and the state governments attract manufacturing into the country of health technology, they will require they'll require these MSMEs as an ecosystem.
And well, finally tell us, how can India realistically balance its ambition to be a global health hub while ensuring affordability and access at the grassroots level?
India needs everything. We need to have a very, very strong public health system, and India does. And on the private healthcare side, I think that some of us might feel that we're overregulated, but by and large, if you ask me, we have a strong private healthcare system. We have a growing insurance. We have technology that will come into play. Young, ambitious entrepreneurs that have started, all this e-commerce, and so by and large, I think that we are on the right path, and I don't see us. There'll be one or two course corrections. There'll be some amount that we'll have to regulate, or I would actually, coming from the private sector, I would say self-regulate. And underlying all this is to have a huge workforce
Sure.
that is well trained, and so we need that infrastructure of education, health education also coming in.
Well, this was a lovely conversation. Our viewers will have a lot to take away. Thank you so much for your time, Ms. Shobana. It was a pleasure speaking with you.
Very nice of you. Thank you, Ritwika. I enjoyed it, and my best wishes.
With that, it's a wrap on this edition of IDFC First Bank Presents Leaders of Tomorrow Season 13. We hope you enjoyed the episode. Thank you for watching. Goodbye.